My name is Masi Nelima. I'm the patient engagement lead at Access Afya, and I would like to introduce you to Afya Mama Chat service that is helping pregnant women adhere to clinic visits, therefore improving their chances of a better health outcome. Access Afya delivers a high-quality, localized primary healthcare operating system designed specifically to serve the needs of low-income markets. We have developed a physical and digital healthcare network utilizing asset-light microclinics, telemedicine, patient health data to engage patients throughout their healthcare journey, from diagnosis to treatment. In Kenya, 362 women out of every 100,000 live births will die due to preventable pregnancy-related complications. Kenyan women living in urban slums are nearly twice as likely to die during pregnancy than their wealthier counterparts. This is attributed to non-adherence to clinic visits that would detect complications early and address them. Reduced access to healthcare information and quality healthcare services are the other barriers to better health outcomes. Take Joyce. She's 3 months pregnant. This is her first pregnancy, and she's unsure of what to expect, where to find help, and what to do to ensure that her baby remains healthy. She meets one of our community health workers in her community who introduces her to our clinic and chat service to support her. Joyce is now able to check her risk of developing complications through the risk assessment prompts, which encourage her to visit the clinic or contact a doctor online through our telehealth platform in case she experiences any of the danger signs. She also has access to health information that educates her on what to expect during this stage of her pregnancy at 3 months, and will continue to provide this information for the rest of her pregnancy journey. She's able to learn about her baby's development and the changes to expect in her body. She will also get reminders about her clinic visits and their importance. This will help her keep track of the tests, vaccination, and ultrasound that she needs to get. Afya Mama will also prepare her for delivery by sharing with her what to expect and a list of what to carry to the hospital. Unlike most providers, we are focusing on bringing awareness and access to the underserved population and ensuring better outcomes for them. Our Scale-Up Plan roadmap starts with the automation of the chat function that will be connected to our electronic medical records to allow for continuity of care and better customization of the chat. We'll also plan on embedding this on our telehealth platform to enable us reach more women. We also plan on integrating trained AI tools to respond to queries. Our CRM integration will enable us better evaluate gaps in individual patient journeys and inform development of initiatives to improve adherence. We invite you to use our chat service by scanning the QR code and sharing it with any pregnant woman you have in your life. Thank you.
Hi, my name is Abdul Muhit. I work at Al Khan University. Today, we will go through an application, Ilaj Aasan, and its chatbot services. Ilaj Aasan is an Urdu word, and the meaning of this word in English is treatment made easy. It's an Android-based application, and it's for the patient to avail the medical services. And the medical services provided by Al Khan Health Services Pakistan. The target population for this application are Gilgit, Baltistan, Chitral, and Karachi. But rest of the Pakistan can also avail the services. The problem which we want to address through this application is the lack of doctor, the issues in the geographical coverage such as weather, landsliding, transport issue, so that they are not they are facing problem in getting medical services such as pharmacy services. So these are the key issues which we want to address. Through solution, we have provided them a secure video conferencing link so that they can get a telemedicine services, a medical data exchange services so that they can share the data easily, the appointment system, so that they can book an appointment prior to the medical service delivery date, and the payment methodologies so that they can make a payment online easily, such as Easy Paisa, Jazz Cash, credit card, and debit card. Till now, we have 4,272 active users, and we are providing them medical services in different areas such as pharmacy, lab services, and medical services. Through the chatbot services, we want to help our user to identify their doctor's specialty and also avail different medical services. So let me show you how the application works. First of all, I will say hi. In response of this hi, it will give me two options. I will say find a doctor. So suppose I have a chest pain. So I will select pain, and then I will say chest pain, and then it will respond that I should see the cardiologist. I will click on this link, open this link, and I will see the cardiologist, and I can book the appointment accordingly. In future, we want to extend this chatbot services in different areas, such as giving users more awareness content, medical awareness, and similarly screening tools so that they can have different screening tool available and they can monitor themselves easily. We will be engaged, like adding more content for patient engagement. We will be using more tools, WhatsApp tools, to improve the health services as well. Thank you very much.
Hi, I am Aditi. Along with Saraswati, we are solving a problem that is very personal to the both of us. I have painful periods. 2 days a month, I take painkillers to go on with normal life. Same for Saraswati. We were both looking to take action to end this cycle of pain. We looked around in India but did not find anything. So we created Cranberry. Cranberry is an AI health coach for women to ease period pain and PMS. I have worked in governments and Saraswati has built and scaled digital products. And now together we are Cranberry.
Let me introduce you to Priya, a 29-year-old menstruator from India. Priya has experienced 200 periods and has 350 more to go. Each cycle, Priya experiences severe period pain, missing her workday. This is a story of 100 million Priyas in India who experience severe period pain and PMS each month. The good news is science has a solution: menstrual coaching. But medically verified menstrual coaching is not accessible to Priyas out there. We are here to change that. With Cranberry and WhatsApp powered by Turn, we are tackling the barriers of access, stigma, and behavior change for Priyas out there. Meet Coach Berry, Priya's personal menstrual coach for pain free periods. Let's see how Coach Berry helps Priya.
Priya's period will come tomorrow and she is in severe pain, so Coach Berry pings her with a reminder. Priya journals her symptom and the severity, gets a remedy personalized to her, and feels some relief from the pain. Priya does not want this severe pain next month too, so Coach Berry recommends healthy habits based on her data. Priya chooses a habit to build, and Coach Berry will now ensure that Priya builds this habit. She gets weekly personalized, easy to do actions as Coach Berry removes any barriers. She joins a micro community of 20 other women forming the same habit. But there are days when Priya has personal questions she cannot ask anyone, say on vaginal discharge. Coach Berry answers them based on the medically verified knowledge base. And then there are times when Priya's body is changing. Coach Berry pings Priya with insights so Priya can prevent pain in the future.
With AI for scale, data for personalization, and community for human touch, Coach Berry is Priya's personal assistant from puberty to menopause. We invite you to interact with Coach Berry or share it with women in your life. Here's to changing women's health one period at a time. Thank you.
My name is Dr. Adureni Abiodun, and I'm the founder and CEO at Help Mom. Today, I want to take you through the wonderful work that we do at Help Mom. At the moment, Nigeria is one of the largest contributors to infant mortality in the world. We lose 2,300 under 5 children daily, and we also contribute to 30% of unimmunized children in the world. The reason why we have this high rate of infant mortality due to vaccine-related death is because poverty and lack of knowledge about immunization. What we did at Help Mom is to develop digital immunization tools to solve this problem head-on. The first one is the Help Mom vaccination tracker that we use to digitally register mothers in remote, rural areas and urban areas in Nigeria. Currently, Nigeria uses paper card to track immunization. So what we've done is to develop a digital tool in which it will be easy for the government to easily track the immunization of children in their state. And currently, we have 2 states in Nigeria that have adopted our Help vaccination tracker. What we've done now is that our newly developed chat box has been incorporated into our Help vaccination tracker. Before, it was SMS that was incorporated into our Help vaccination tracker, but our chat box has now been incorporated, which sends reminders to mothers on when the immunization of their child is due, and also they can ask questions if they have any question about why they should take their child for immunization. The second digital immunization tool we developed is the Help Mom Advisor. We noticed that it is not all mothers that we send reminders to that take their children for immunization. So that's why we developed Help Mom Advisor. So Help Mom Advisors help us understand the barrier for every mother registered on our vaccination tracker why they won't take their child for immunization. So the Help Mom Advisor provide interventions like the Help Mom Advisor can say this mother needs travel voucher, this mother needs you to take the immunization to their home. One of the things we also did is to incorporate the Help Mom vaccination chat box into the Help Mom Advisor. So what that means is that for mothers that have the financial means, the Help Mom Advisor knows that they just need sensitization, and that's why they've not been taking their children for immunization. So the Help Mom chat box is what sends reminders to them, and the mothers can interact, ask questions, and this will help them take their children for immunization. At the moment, over 86% of mothers preferred the chat box to our previously used SMS. Before, like I said, we used to use SMS to send reminders to mothers to take children for immunization. But now that we launched our chat box like 2 months ago, more than 86% of mothers preferred the chat box, and also 67% of mothers took their children for immunization from the chat box reminder that we sent. And the reason why we were able to come up with this data is that we are tracking them, and these are the early results that we have. This is our chat box service. You can scan it, trigger the message on it with I or A, and you'll be able to interact with it. We have services like importance of immunization. We have a location service where you can find the nearest location to you where you can take your child for immunization. And we have loads of services on our Help Mom vaccination chat box. I'm ending this presentation with a popular saying in Africa that it takes a village to raise a child. Today, we are calling on everybody on this call to join us and partner with us to help millions of children in Nigeria and in Africa reach beyond the age of 5 with the digital innovation tools that we've developed, like the Help Mom vaccination tracker, the Help Mom Advisor, the Help Mom chat box. Thank you very much.
Hello, I'm João Abreu, and 4 years ago, I co-founded the health tech nonprofit ImpulsoGov. We are building the next generation primary care system, starting in Brazil, the world's largest public healthcare system, serving over 150 million people, 100% for free. The system, however, is not working well enough. Every single year, over 50,000 people die needlessly because of failures in the primary care services. We are now focused on a subset of this problem: women that are dying of cervical cancer because they were not properly screened early on. This shouldn't be happening. First, cities now have the right incentives, thanks to recent legislation, to solve this problem. They get paid every time they successfully screen women for cervical cancer. Second, we have the data and technology to know who these people are. Recently, 9 out of 10 health units in Brazil use electronic health records, which allows our work to happen. For over 1 year now, we built a data product freely available that allows city governments to go to an individual level. We provide lists that allow them to know exactly which women have been left behind. Either they never did a screening or they did, but it has been a long ago. We help governments with identifying exactly who these people are. We list women that have never been screened or that were screened but long ago and they need to be screened again. With the help of this accelerator, we're going to do 2 things. First, we're going to make sure healthcare workers can actually use this product. We have a problem today. 1 in each 3 healthcare workers that receive the information to log in our system never do so. The main reason is low digital literacy, and we want to solve this with messaging. We're going to send them messages not only to remind them to log in if they haven't yet, but also with a step-by-step guide to overcome any challenges. Everyone that wants to log in needs to log in. You can check this on this QR code and also using the sentences on the left of this slide. Finally, and most importantly, on phase 2, we're going to go to the citizen level. We're going to directly message women that are behind on their cervical cancer screening. We have already done that successfully. In 1 city, we managed to more than double actually, the number of cervical cancer exams. If we manage to do this in Brazil, nationwide, we're going to avoid over 2,000 deaths every single year. That's exactly what we're going to do next. Thank you for your support.
Hi, I am Shipra Davar, and I'm the founder of I Will and Eastside Clinic, leading digital mental and wellness platform from India, talking about the need. 600 million plus people are underserved when it comes to mental wellness and reproductive health and other wellness services in India. 1 billion plus people when you look at the global south. I Will is a complete digital mental wellness and other wellness platform that has clinician-led digital programs in multiple languages, AI-based programs for preventive and mild care, and also for tertiary care, we have partnerships. Talking about what sets us apart, well, it is reach with relevance. It is agency with accountability. It is accessibility with affordability. And it is innovation with impact and interoperability. And how does that translate? Well, we've helped more than 600K plus people, of which 98% people had help for the first time. 300K plus people were from rural parts or semi-urban parts of India, and 10 million plus people we've helped through our content, through many partnerships, and through social media. Now, WhatsApp is so important for us. 800 million plus people in India use WhatsApp. And this is the demo of the service that we've built through the accelerator. We've brought our clinician-led program on the platform, and we'll bring all other services. It starts with an analysis, which is a clinically validated scale to look for signs of anxiety or depression, and then it pairs them with the right therapist for them and also the right program for them, as you can see. And then they can just book a single session or a package and have the conversation with the therapist on this platform itself. And that opens up a lot of reach and a lot of agency for people. Now, what sets us apart is that we are a team who's worked on the ground. We worked with government. We've worked with several partnerships. We are mental health professionals. We are business professionals. We are technologists, and we're people from communities. Our goal is to help 20 million plus people in the next 3 years, 100K plus people through WhatsApp in the next 1 year, bring all our services over WhatsApp, as well as our reproductive health and wellness services with intersectionalities of mental health. Thank you.
Hello everyone, Rob Knowles here, Head of Growth at Coco, and our mission is to help end the youth mental health crisis. And we are indeed facing a crisis. According to a study by the CDC, 22% of young people in the US have seriously considered attempting suicide. Now, it can take years for someone struggling with mental health to actually get help, and yet there are millions of young people reaching out for help right now on the platforms they use every day. But these platforms weren't designed to treat mental health. In fact, if anything, for many people, they can make things worse. Imagine though if all the millions of young people reaching out for help online actually got help. We could create the largest mental health intervention in history. Our team is working to make this possible. So how does Coco work? Let's imagine a young person, maybe they're 15, and they go online and they're searching for harmful mental health content online. Now, ordinarily, they might see dangerous content that can easily worsen a depressive episode. So let me show you a different story. Imagine this person searches for this content again, but this time they don't see anything harmful. Instead, they're presented with the option to try Coco's peer support service or one of our many interventions. One click and they are on a completely different mental health trajectory. I'm going to pass over to one of our real users who's going to show you how our WhatsApp bot works.
I've got to turn you guys on this peer-to-peer support chat called Coco because it's honestly something I've never seen before, and it's really been helping me feel less stressed about my life. Coco is completely free, which I love because I do therapy and that can be expensive sometimes, so it's nice to have more affordable options, and it's just a way to connect with people just like yourself about anything you may be struggling with. It makes you just feel way less alone in life. I also love that you can check up on somebody after you've given them a better perspective on their situation, and they can do the same thing for you. And remember, it's completely anonymous, and also they don't share any personal information to third-party services. So if you feel like anything's been weighing on you, but you can't talk about it, just try it out and see how it makes you feel.
So, does Coco work? Yes, we are among the most evidence-based services in the market with multiple peer-reviewed papers, multiple randomized controlled trials, and our engagement numbers are extremely high. We've 10x'd our growth in the past year, and reached over 2 million young people. And we are just getting started. We want to see a world where any young person can access a service like ours for free, zero friction, completely ubiquitous. And this isn't just about mental health. This is about saving a generation. So please join us. Thank you.
Hello everyone, my name is Alex Rukunya and I am from Rocket Health Uganda. We offer telemedicine and last mile delivery of medical services. So the problem you're solving is that of accessibility. Taking a case in point, Harriet, a busy single mother who is a working class, has a young family and she has to make sure that whenever they are sick, they can access healthcare. But at the same time, she takes care of her elderly parents who have chronic illnesses like hypertension and diabetes. Harriet is one of the 40 million Ugandans who access their outpatient care through private healthcare. These often attend around 4 visits in a year and spend around $30 per encounter. If we assume that 70% of these Harriets get their health care through telemedicine, this creates a market size of about $1.6 billion for us at Rocket Health. And the solution we are offering is that of an automated chat service that will allow real-time access directly to our services. This will offer convenience in a sense that anyone, anywhere, anytime can access our services. It will be available 24/7, which will allow clients to order medicines or teleconsultation, and patients with chronic care can order their medicines and have them refilled. This is how the service works. When a customer comes to our WhatsApp, they'll simply say hi, and then they'll select the service they would like. One special thing we did with our chat service is integrating an e-commerce feature into it. The client will type in the product they want. We will return the first 5 products that relate to that string that the customer typed in. They select the product that they want, and then we start onboarding. What sets us apart from competitors is that if you look at Rocket Health, a telemedicine-centered approach, compared to other competitors like community pharmacies and community labs, we would score across variables like accessibility, affordability, and quality. Our future plan is to launch this WhatsApp chat, which will help us reach over 500,000 clients on an annual basis, which will automatically mean revenue will increase, and these learnings from Uganda will be used to scale across East African countries. And finally, our customer satisfaction rates will go high. Feel free to reach us, and the contact information is here.
Hi, my name is Joy Bittner, and I am the creator and co-founder of the nonprofit organization Vida Plena, based here in Quito, Ecuador. Our mission is to bring strong mental health to Latin America. So why Latin America? Well, because there was a poll conducted by the Wellcome Trust Foundation in which they asked people worldwide if they'd ever had a significant experience with depression or anxiety. And Latin America, at 33% of respondents responding positively, yes, they had, was the highest in the world. And then specifically, Ecuador, where we are based, is listed by Gallup as one of the top 10 worst countries in the world for mental health, alongside Iraq, Afghanistan. However, the Ministry of Health only spends 0.04% of its national budget for health on mental health, meaning the vast majority of people are unable to access any care. However, the good news is the model that we are using is recommended by the World Health Organization as being its first-line treatment in low-resource settings. It's a simple method which is composed of forming therapy groups of about 6 to 8 people who meet weekly, and their discussions are guided by a trained and certified local community member as a facilitator. There's over 15 years of evidence and research demonstrating that this is effective. And in our own pilot studies, we saw great results in which 76% of people who entered a group with moderately severe depression finished the 8 weeks with low to no depression. It's our goal, desire to be able to scale this. And so that's where we are really proud to be able to have partnered with Turn.io to be able to create a WhatsApp-based chatbot. As you can see through this example here, our goal with our chatbot is to be able to expand our outreach services, helping people to conduct self-screenings, learn about depression symptoms, and get quick and easy information about the support group that is meeting nearest to them. Our goal is to be able to scale this nationwide within 5 years. This is absolutely doable. One facilitator could reach 400 people in a year, and our goal to add 25 new facilitators each year means that within 5 years, we can treat 50,000 people for depression annually. Thank you so much for joining us in this journey and supporting us in this vision to make evidence-based mental health care available to everyone throughout Latin America.
Hello, I'm Ankita, and today I'm going to talk about our vision to help people with their mental health challenges. Visa is an AI led mental health chatbot, and so far 6 million people have already used it, and it has saved 380 lives. And by 2030, we aim to impact 50 million lives. Do you know around 150 million Indian adults suffer from mental health disorder? And we've got only 0.07 psychologists per 1 million people. This data seems so unreal, right? And that's why 80% of them cannot get treatment. So, what should an ideal world look like? Let's take a peek. This is Neelam. Neelam is a housewife. She gets anxiety attacks, but she has got a repository of tools that can help her. This is Shiv. Shiv is an Uber driver. His long working hours gets really stressful for him, but he's got a friend he can talk to about and vent about anything anytime. And this is Afreen. Afreen struggles with her identity, but she has got a non judgmental friend who is helping her gain confidence to accept and love herself. So you see this gap, right? This is where come in to bridge this gap. Meet Vyasa. Vyasa is that chatbot friend who is helping Neelam and Shiv and Afreen in that ideal world. Vyasa aims to bring mental health care to every individual right at their fingertips. Vyasa is available 24/7. All the conversations done with him are completely anonymous and it does not store any user data. The bot is designed in simple Hindi language for ease of understanding. All the tools provided are clinically validated and effective, and Vyasa aims to inculcate building resilience within people. Vyasa wants to help people with their life challenges. As soon as a user consents to start a conversation with Vyasa on WhatsApp, he then encourages them to build resilience through storytelling narrative. And then he leads them to an evidence based self care tool repository, which is available in their local language. The chatbot also has some emergency helplines in case someone needs urgent help. So, what's next? There are around 500 million WhatsApp users in India, out of which 41% are Hindi speaking. Also, data suggests that 65% of young adults prefer getting mental health support through WhatsApp. So, WhatsApp can be that platform for us to provide a democratic, inclusive, and scalable mental health care at every corner. And for this, we seek to find partnerships with public health bodies, donors, governments, and HNIs. Vyasa aims to be a part of the user's journey to well-being, while they also help others in the journey along the way. Thank you.